Hey everybody, this is Munson Steve, and welcome to another edition of Health IQ. What makes it special today? Well, every day is Black History Month and Black History Day. It's a Black History moment. It's a Black History moment for your health every single day. At least that's how we want to treat it. But one of my favorite practitioners, that's somebody who loves the community, serves the community, writes books for the community, and really reaches out to the community. It's always available to heal the community. Dr. Frita, how are you?
I'm doing great. How are you doing?
Well, outside of I don't have your cheekbones, which thank God I probably look kind of crazy as a dude walking around like that. Not even Denzel's chiseled like that, or Idris Elba. So we're cool not having that. But other than that, it's the brain that you have as a healer. Our health as a community. What should be our first priority, given that we now know the history of our health from parents and our genes plays a role in our health as we progress from childhood to adult?
Our role and our goal should be to, yes, understand our history, understand our genetics, because there are many illnesses that plague the Black community specifically, largely environmental, which we'll get into that. But for some things, we are genetically predisposed. And so it's important for us to not keep secrets in the family, because our secrets make us sick. If you are diagnosed with prostate cancer, instead of being so secretive because you don't want to be looked at as weak, let the young men in your family know, let the ladies know so they can share it with the men and they know to get screened early. Same thing with breast cancer, colon cancer, all of it. We need to share with our families what our histories are. And then the other important thing is to understand that prevention does work. Instead of just kind of shrugging our shoulders and saying, high blood pressure just runs in my family. Heart disease runs in my family. We need to figure out what we can do to prevent these illnesses. Instead of just sitting here and being victims of the illnesses, we can be proactive for our health.
Thinking about proactivity, the word we have this year for sisters with superpowers like yourself is agency. That you have to take both control of your agency, consumption of food. But why does agency play such a role in the lives as it relates to having agency over your health?
Because it puts us in power. We are in a position, especially as a Black community, where when we pause and you look at the statistics, things can actually get quite depressing. When you look at the level of wealth for Black people in this country compared to others, not great. When you look at the cancer, as far as who dies the most from different cancers, who has the most obesity, even when you look at schools, as far as who has access to the greatest education, it can make you feel like you're a bit powerless sometimes. And even in the political arena, you can feel a bit powerless. But when you take agency over yourself, when you take control and you actually are proactive and take action, then it can help to kind of boost your esteem, boost your energy, and make you more motivated to help yourself and to help others.
You're sitting at home, you're watching this video, you want to take agency. Having a health evaluation every year, over 50, maybe twice a year, how does that play a role when a physician knows that a patient's going to come in on a regular basis?
The squeaky wheel gets the oil. And maybe it shouldn't be that way, but it is. When you go in to see your doctor and you have your list of questions, your list of concerns, you've done your research. Now understand, if you're not a physician or a healthcare provider, then the research that you do on the internet does not replace your doctor's knowledge. But when a physician sees that you've taken interest, then that physician will take an interest in you. And so the doctor will look, see your name, and they'll be like, oh boy, here comes Miss Rosa, and she's going to have all these questions. Let me just sit down, not try to talk over her head and explain, because she's going to ask me until I answer it. And so when you let a physician know that you're interested in your health, then the squeaky wheel gets the oil and you will get better care.
You wrote a book for us to really understand who we are, address our pressure. And I want to say thanks for that, number one. Well, what's in the book and why should we understand that even reading and taking agency over our knowledge about it. Can you explain it? Give us a title, and then why you thought it was important to write it down and to put it in a book.
Absolutely. Yes. The book is Under Pressure, A Guide to Controlling Blood Pressure, and it's available on Amazon. And I wrote it because a lot of patients will come into my office and they'll have blood pressure sky high, 200 over 110. And the first thing they'll say is, I don't want to take any medicine. I just want to be holistic, which I understand. But what happens is that when they go to a typical physician, someone who's only trained in Western medicine, someone who does not know much about food as medicine, herbs, things of that nature, that physician will shut them down. And so what often happens is that even when patients want to take control of their health and they want to do things that are natural, they'll start to feel shamed by physicians. And so what happens? They don't go to physicians. So in this book, Under Pressure, A Guide to Controlling High Blood Pressure, I talk about medicine in the Western traditional way in which I was trained. And yes, there are definitely times that traditional medicines are appropriate. I use medicines. If you walk into my office with a sky-high blood pressure, I'm not giving you garlic and herbs on that day. I'm giving you medicines to keep you from having a stroke or a heart attack. But I also am going to implement the different foods and the lifestyle that will help with the blood pressure. So in this book, I talk about integrative medicine. I talk about how the cruciferous vegetables like broccoli, kale, cabbage, Brussels sprouts can have phytonutrients that can help to lower blood pressure. I talk about fruits like raspberries, blueberries, blackberries, how they have antioxidants, which fight inflammation, fight free radicals, fight cancer-causing agents, and those also help to reduce blood pressure. I talk about beets. Beets have nitrates, which your body converts to nitric oxide. That helps to lower blood pressure. I talk about meditation, things of that nature. And I also talk about the role that having a low income will play in your health. We all talk about, go eat, fresh foods, organic foods. But if you don't have a Whole Foods or a Sprouts around the corner and you don't have a car, you can't get those foods. Or even if you can get to one of these expensive restaurants, if you don't have the money, if you're on a fixed income, you can't eat those foods. So in this book, I talk about how wherever you are in your economic status, how you can still be healthy. And so the book gives a real comprehensive way on integrative health, the natural medicine, and how to know when it's appropriate to take traditional medicines. And it's really all in talking to a physician you trust.
Well, I really appreciate that. And I want us to all think about the actions we can take for finding one person to buy and share this book with. So it's not a plug for a book, but it is a plug so that the knowledge makes it into the home. You can share it, you can read it with friends. And I think that I want the community to know that you really gave us some healing principles inside that book. So thank you very much for that. Let's talk about the fact that now we are in a place where you have to advocate, and it's okay. Is it okay to advocate for yourself when you go to the doctor? And at least tell us what advocating is first, so you don't go in there sounding crazy and then the doctor just calls security.
Right. Not only is it okay to advocate for yourself, it's absolutely necessary. I'm so excited that now some of the things that have been going on, some of the disparities that we've known about for years are now coming to the forefront. For example, Black maternal mortality and how Black women are 3 times as likely to die around childbirth. And that's not a socioeconomic thing. Even highly educated women with high incomes, same thing. There's a certain implicit bias that puts us at risk. Well, when you advocate for yourself, when you go in, you have a knowledge, you speak up for yourself, and you're not afraid to speak up to authority. That's what it means. Instead of worrying about being polite or kind of taking this approach where the doctor is like, the paternal or maternal figure and you just don't question them. No, you do question. It's okay to question authority. And there's a way to do it in a respectful manner. But quite frankly, a question in and of itself is not disrespectful. So ask questions if you don't understand. If you're in pain, they give you medicine. Don't think, they gave me medicine. I don't want them to think I'm pain seeking. No, you say, guess what? I still hurt. And so they'll either have to give you more pain medicine or explain the mechanism of the pain medicine, but you speak up about it. If you don't understand why you're being discharged from a hospital when you still really don't feel great, you speak up. And there are levels. Just because the nurse or the tech or even the physician says, nope, you got to go, there are levels. At different hospitals, there are always patient advocates or there's patient places where you can complain even before you leave the hospital. Because truth of the matter is, it's a hospital, it's for healthcare, but it's also a business. And so don't just take no for an answer. No, you don't have to scream and holler and show out and have security called on you, but you can say, you know what? I'm not comfortable with this, doctor. Respectfully, I'd like to speak to the patient advocate of this hospital. So that's what it means to advocate for yourself. You understand that you have the right to have good health care, and you can and you should question authority. Speak up for yourself and for your loved ones. Yeah, that was one of the hard things with the pandemic when there was a lockdown and loved ones weren't allowed to be in the hospital rooms. That's where we lost that advocacy. But now, everyone really needs to just speak up and again, be that squeaky wheel and get the oil.
Agency and diabetes. You get the notice that you're pre-diabetic. What should some of the first steps for a person who has been given a indicator, hey, pre-diabetic? What do you say, Dr. Frita? What's on the menu at that moment? And what are the actions that we can take to begin to heal with a health practitioner at your side to make sure that you don't become diabetic?
Right. The first thing you should do is be thankful that you got the warning of being pre-diabetic, because a lot of people don't get that warning. They show up and they already have the kidney failure, the heart disease, they're already in need of an amputation. So that's the point of going to the doctor, even when you feel okay, to get screened to find out if you're pre-diabetic. And the way you find out is from that hemoglobin A1C test. And if they find that it's greater than 5.7, but less than 6.4, then you're pre-diabetic. So you still have time to do better. So what do? Number one, you educate yourself. And I'm very excited that I have a YouTube channel, Dr. Frita. We're up to over 500,000 subscribers. We have over 37 million views. And I give a lot of information on all kinds of health issues, but diabetes in particular. I have Diabetes Explained as a video. What does sugar do to your body? So you want to go and educate yourself to learn what diabetes is and how serious it is. And I'll tell you how serious it is. It is the #1 cause of kidney failure in this country. So when I see patients on the dialysis machines and my dialysis units, most of them have diabetes, which is largely a preventable disease. How do you prevent it and how do you manage it? Well, diet is going to play a huge part. Number one, you want to stop putting added sugar into your body, or make sure you limit the added sugar. So things like processed foods, juices, sugary drinks, candies, cakes, all of those things with added sugar, you really want to push them out of your diet or certainly limit them. And that can help to prevent you from progressing to actual diabetes. You want to have a healthy weight. So the BMI, which is not actually necessarily the best measurement, but it's the measurement that most doctors will use. By the BMI, if you have a BMI that is 25 or higher, then you're considered to be overweight. And if it's over 30, you're considered to be obese. And that puts you at a high risk if you're living with obesity or overweight. So what you want to do, number one, talk to your doctor and find out, okay, this is a BMI, but for me specifically, what is a healthy weight? Because there are different ways where your doctor can figure out how much fat you have in your body, your bone density, your muscle mass, to figure out what weight is right for you. And you want to do your best to get there. You want to exercise, you want to drink a lot of water, things of that nature, and just getting rid of belly fat and just getting rid of the excess abdominal fat can actually decrease your risk for diabetes. So yes, if you get that pre-diabetes, you want to take it seriously before you get there. But if you get to pre-diabetes, it's kind of like the bell is ringing. That's a final warning to get to a healthy weight. Stop adding the sugar, because diabetes, again, is the #1 cause of kidney failure, and it's a leading cause of heart disease, strokes, and it's something that's manageable.
Lastly, just mental health.
Ooh.
We're here, obviously, oppression. We literally have to manage through circumstances, microaggressions, all of that. How can we take our mental health seriously?
I'm so happy now that I feel like the mental health stigma is slowly being pulled away, especially in the Black community and with our Black men, where having a mental health issue by many has been perceived as being a negative or a sign of weakness. mental health is just as important as physical health, because if you don't have it, if you don't manage the mental health, then you can have some detrimental consequences. Number one, if you're someone who's very depressed, you might not be motivated to take care of yourself physically. Or if you're very depressed, you might get to the point where you don't even want to live on this earth. And so if you're having signs of depression, feeling that you have anhedonia, where you have an inability to experience joy, or if you're watching loved ones and you're wondering if it's someone, say, who used to love playing basketball or going fishing and now they don't want to do it anymore, or someone who doesn't have the proper sleep patterns, they're either staying up all night or they're sleeping all of the time, just talk and ask them and check in on your strong friends, as they say. And don't be afraid to go to your physician and say, you know what, I'm having a mental health issue, or I'm feeling sad, or I'm feeling anxious, or I'm feeling, fear of leaving the house, or I'm feeling like I'm having flight of speech. Whatever it is, you want to address it. There's no stigma. Mental health is just as important as physical health, and it's quite necessary in order for us to get through with a nice, healthy IQ.
Love that, health IQ. When you come to maintenance, what should maintenance be? We literally are at that moment. You may not have. How can we judge what our health maintenance is, and who can we get a health maintenance plan like from some doctor like you, Dr. Frita?
Right. So you get it from your primary care physician, like your internist or your family physician. And it starts by doing a history and physical, right? Where they go through, they ask you your family history, your personal history, your surgical history. They go through all of these things, determine risk factors, and they'll do certain tests. They'll screen you for diabetes with that hemoglobin A1C, screen you for anemia, screen you for cholesterol, all of the risk factors for some of the major illnesses. Depending on what they find, if you have a squeaky clean bill of health, they might not need to see you but for every year. But in that health screen, they'll also find out which cancer screenings you should have based on your age. Colon cancer, at one point, it was recommended that we get colonoscopies by the age of 50. Well, now the recommendation has moved down to the age of 45, especially for Black people who are at a higher risk of having colon cancer earlier and in more aggressive forms. The trick is there's still a lot of insurance companies that are lagging behind. So you might go to your doctor, they say, okay, I recommend, you're 45, get the colonoscopy. You go to the insurance company, they say they're not covering it. That's when you have to be an advocate and you say, what? I need you to do a pre-authorization, doctor. I need you to fight for me. And you be that bug in their ear, that squeaky wheel, until you get it done. Same thing, breast cancer screenings, cervical cancer screenings, prostate cancer. And, and right now we know in the news, we've got Secretary Austin, who is living, thankfully, but had the prostate cancer. And then we lost, of course, Dexter King, Martin Luther King Jr.'s youngest son, to prostate cancer. And you want to talk to your doctor because the prostate screening can be a bit controversial. But if you are a Black man, you are considered to be at high risk at minimum, and you might even be at very high risk. And so you want to go in and find out about that. But it's all going to depend on what medical issues you have, on how frequently you get screened. But it all starts with going in for that history and physical.
Well, I thought maintenance, we've had a wonderful time. Be sure to check her out on YouTube if you want some more of this good stuff from Dr. Frita. Thank you so much for your continued love and healthy healing that you provide our community. I'm Munson Steed with Dr. Frita. It's a great February. It's a great Black History Health Month every single day. So it's not this month, but we wanted to kick it off with someone special. We're going to put this out a couple of times because you make such a big deal and allow us to be ourselves and speak so eloquently to how we can bring and take agency back to our health. Dr. Frita, thank you so much.
Thank you. It's my pleasure always.